I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Glad to be here. Glad to have you on. What a beautiful, beautiful day. One of the last glorious, I think, sunny and warm days. But we have magnificent winters here as well. So I look forward to all of that. Today we begin our program with my guest from the North Memorial Health Community. In particular, I have Dr. Todd Stanhope. He's the medical director of the OBGYN hospital team at North Memorial Health. He's an expert in obstetrics and gynecology. He oversees the full spectrum of maternity care at North Memorial Health, and he enjoys working with customers and their families to achieve safe delivery consistent with the customers' preferences. Also joined by Rebecca Polson. She's the owner, director, and a midwife at Roots Community Birth Center, located right here in North Minneapolis. Through her leadership, Roots offers out-of-hospital births and culturally centric care that is accessible and welcoming to all families. I've been having several of these programs with our friends and colleagues at North Memorial, and they have been illuminating for me, and I want to thank both of you and thank the people at North Memorial for engaging, for reaching out and connecting with us, talking about the value proposition. North Memorial is a great institution in our community. It's sensitive to the community. It's changing with the community. And I want to just say that as a message that cushions today's conversation. Dr. Stanhope, let me start with you. Straight up, what are the options available for care for mothers and their babies at North Memorial Health?
Sure. Thank you for the question, for the kind introduction. It's a pleasure to be with you today. Thanks for hosting us. I like to say that we offer anything that can come the way of a mom or baby. From those who desire, so those who are in labor or have a planned cesarean, we have a variety of options. For those laboring, we can provide support for those who desire an unmedicated delivery. We offer epidurals and, of course, offer some other options in between for helping support discomfort during labor. We also are very fortunate that we benefit from the resources of being a level 1 trauma center. Mm-hmm. So for those who need escalating cares, if there's an emergency that occurs associated with the labor, we have the experts in our facility available 24/7 to be able to address those needs. So we're very fortunate to have those. And we can also address really anything that comes the way of a newborn baby. Mm-hmm. We take care of babies born as early as 22 and 23 weeks, babies that are born under a pound. And so we're very fortunate that we have our NICU and our NICU team available 24/7, that if a baby is born and needs support or help unexpectedly, we can start those cares immediately.
NICU means what?
Oh, thank you for clarifying that. So neonatal ICU. So it's a unit specially designed for newborn babies of any age, born at 23 weeks or born at their due date. If they need special cares, we have a special unit dedicated especially to caring for those babies.
Awesome. Great. I'm Al McFarlane. This is Conversations with Al McFarlane. Today's program, Tuesday's program, always live here on KFAI radio, but also streaming live to our social media platforms, the platforms of Insight News and McFarlane Media, Facebook, sharing and reaching people through Twitter and Instagram as well. We also have the great fortune of our association with the Black Press of America. My organization, my newspaper organization, Insight News, is an active member in the Black Press of America. Our organization is called the National Newspaper Publishers Association, and this program is carried live, streamed live to the National Newspaper Publishers Association Facebook page. It's called Black Press USA, so we thank them as well. Thank you wherever you are for listening, checking this out. We want you to like what we're doing, comment, send us notes, suggestions, questions. We think this is an important conversation. We call it robust conversation, and we think it is exactly that. Rebecca, let me welcome you again and respond to the same question about, what kind of care do you provide for mothers and babies? But let's do Roots Community Birth Center 101. Let's tell the story, first of all, and introduce people. Thank you for your smiling presence. Those on radio, I'm describing a marvelous smile, and I think you are feeling it on radio as well.
Well, I hope so. Thank you so much for having me on. I have been a longtime listener, so this is very special and dear to my heart. So my name is Rebecca. I am a midwife. And like you said, let's do a little 101. What is a midwife? A midwife is a trained and licensed healthcare professional. We can be primary care providers, and we specialize in very specifically pregnancy, birth, and the postpartum period for birthing people and their babies. We are experts in normal birth. So we are very committed and very specially trained in supporting normal, healthy, low-risk births, and of course, then leveling up when we need to if something comes up. Now, a little bit more about Roots.
Mhm.
I started Roots in 2015, very specifically as a way to address the needs in the community. I had seen the divestment of communities from the North Minneapolis community. I was previously a community organizer for Harrison in North Minneapolis.
Mhm.
And so I've been really committed to addressing the roots of systemic racism and how it applied to our community. I saw all this public health data about what we're experiencing around our increased maternal mortality, our increased neonatal mortality, and all the things that go along with that. And for me, I wanted to say, what does it look like when we bring these things, birth, back into the community? Because I see the community as the wellspring from which our health comes from. So I set up Roots very specifically to offer those options in the North community. So we provide full prenatal care from the time you might think that you're pregnant
Mhm.
to all of the visits, the labs, everything through the birth of the time when you go into labor. And then you can birth your baby in Roots facility. And then we take care of you both after the baby is born for about 6 weeks. As a part of that, we do what makes Roots different is that we really focus on what health means for individuals. And individuals are components of families, they're components of community. And so we bring all of that into our care. So we do it very differently. Some of the things look the same as you might see in a regular clinic experience, but some of those things also look very different.
So, Rebecca, how do mothers learn about the options that are available to them? How do they get an awareness about how to access care?
There are a few different ways. Word of mouth always, as we know, the North Side's a very close community. So people share about their experiences birthing with us, but also through our social media, through our Instagram, through our website, rootsbirthcenter.com, through our Facebook. We really try to get the word out in all the ways that people are learning about birth and parenting.
You both mentioned, or I think Dr. Stan Hope mentioned levels of medication. I think you might have used the words unmedicated birth experience. As a guy, the notion, the thought is frightening. Talk to me about that. I mean, so let me disclose. First of all, I'm just an ordinary. I call myself dumb guy when it comes to understanding, the things that and the strengths that women bring, our wives, our sisters, our moms, our daughters bring to this marvelous activity that sustains our existence as human beings. And I want to, with all reverence and with all respect, pay homage to the power, the strength, and the miracle of womanhood. So start with that. And having said that, I'm saying just I'm regular old, don't know kind of guy. So how do you educate people like me so that we can ask good questions and be supportive of the women in our lives who are thinking about or experiencing birth? And so that was the space where this unmedicated birth experience question comes from. Dr. Todd, what do you think?
Sure. Well, that was very eloquently stated. And when I'm asked, why did you choose OBGYN? My answer is the miracle of birth. So I can fully relate to the spirit of that question. Mm-hmm. So there is a spectrum of options that a person can consider for support during their birthing experience. And those things range, as I mentioned, from really nothing to epidural being the strongest, most effective for reducing pain associated with contractions. So there's a lot in between. And as you allude to a little bit, there's a role for the support persons. And I look forward to Rebecca talking on that a little bit, because I think that's one area where she and her colleagues really shine. But starting with unmedicated, we define as we're just not giving medication for pain. Mm-hmm. That doesn't mean we're not doing anything for pain. It just means we're not administering medication. So things that can be included are hand and foot massage, leg massage, comforting words, creating a setting in the site of the labor room or wherever they're choosing to deliver that is calm and comforting. So music of their preference. Sometimes it's television. Sometimes it's scents. And often it changes moment to moment throughout the course of a labor. Some other objects that we offer to support that labor experience include things like birthing balls. Often it helps to sit and bounce on a ball, to move back and forth. That movement during birth can be helpful. We also have tubs in all of our rooms where we offer baths for the purpose of helping with discomfort during labor. We don't offer water births, so actually birthing the baby into the tub at North. That's something that Rebecca, I'm sure, will be glad to talk about as well, because they do offer the water birth, but we do offer that hydrotherapy or sitting in the tub during labor. Okay. Then for medications, there are really three predominant options that we utilize. One is laughing gas, nitrous oxide. So it's self-administered. The patient just holds a mask over their face and then breathes during contractions. That can help reduce discomfort associated with the contractions, but still keep them mobile and able to move around the room during their labor experience. We also offer medication through the IV, a little bit more potent, but a little bit more side effects. And then perhaps the strongest in terms of pain relief is the epidural. And so the epidural, to give a brief primer on that, is where an anesthesia doctor uses a needle to place a thin tube in the patient's back. And that continuously offers medication that numbs the individual from roughly their rib cage to their toes. Okay. So it's the strongest in terms of pain relief, but the important thing to know from that is it reduces strength in the legs for the time that the medication is running in, meaning that individual is confined to their labor bed for the duration that the epidural is working.
Okay, amazing. Rebecca, I think my notes say that 65% of your patients are African Americans. Talk about the demographics. Talk about our community. I live here in North Minneapolis, and I have been here since I think 73. So I'm pretty familiar with most places and most things. So, who and how do you serve in our community?
Yeah. So like our demographics say, about 65% of our clients are African American. 75% of our clients, one or both partners, are a person of color. So we also serve other cultural communities, Latinx community, Indigenous folks, Southeast Asian folks, our African-born brothers and sisters. These are all the families that come to us and bring their desire for birthing with us. We serve everyone from, I think our youngest client has been 16 up to 52. So we've got a wide range of who has babies. Most folks are in their 20s, 20s to early 30s. But the one thing that does happen for all of our clients is that they have to be low risk. So we work really hard with everyone to help them stay low risk, but there are some conditions that we can't take care of. And that's when our partners at North are super instrumental in taking care of those folks who are a little bit higher risk. We care for people who are between 37 and 42 weeks when they give birth. I know everyone talks about months. We actually count pregnancy in weeks, and 37 to 42 weeks is what we consider full term. So.
Okay. So talk about the partnership more. How does it work? How do you, as you mentioned, make an assessment that a person that is approaching you probably may have challenges that are best suited to be dealt with in the hospital setting? How do you determine that? And does the referral ever go the other way, Dr. Stanhope? Do some patients come to you curious about different modalities, and through your advice are incented to call up Rebecca and find out about what that would be like?
Yeah. So, like Dr. Stanhope had spoken about a lot of the support techniques that are available. We overlap a little bit in that. And the first kind of risk criteria for Roots is a desire for an unmedicated birth. If someone wants an epidural, they will not be happy coming to us because we do not offer that. So the first risk criteria can be someone's desire and what they really feel called to for birthing their baby. But in general, we need someone who has one baby, no twins, head down, we don't do breeches, has regular blood pressure without medication, and doesn't have diabetes, either gestational diabetes or type 1 or type 2. There's so many other things that can come up, but part of our prenatal care is always keeping an eye on making sure things are healthy, that baby's growing well, that the pregnant person is maintaining their health, that they're getting all of their needs met to stay healthy, and that that they're equipped to have a natural birth. So we do a lot of water birth. About half of our babies are born in water, so we offer a lot of water and movement. We don't attach belts when we're listening to baby. If that becomes necessary, that's a reason we go to the hospital. We also have laughing gas. So this is one of these little overlap things that we do. And then we also obviously provide a ton of support. We also have a volunteer doula program. So if folks can't afford a doula, they can get a professional labor support from a volunteer doula.
Explain the term doula. That's the first time you've used it today. I've heard it before. I kind of know what it means, but it's always good to hear it, to be reminded the origin of the word and the concept of doula.
Doulas are trained support people who are not medical providers. So their job and they're an amazing part of the team, no matter where you're having your baby, no matter what's happening, whether you're high risk, low risk, or anything in between. Doulas provide emotional, social, and physical support while you navigate pregnancy and the birthing experience and postpartum. So doulas work in all locations, all types of birth. You do not have to plan a natural birth to have a doula. They're just there to provide support. So they can be really instrumental in helping partners and the men who are attending births to understand their role. They do not take the place of partners. They can help extended family be a part of the birthing process, friends. They're just instrumental, but they're not a trained medical professional. Our job as medical professionals is to watch a pregnancy and diagnose when something is wrong, and I'll hopefully keep people from having something go wrong. So we can actually treat and care for issues.
Are there male doulas?
There are a couple out there. I do know of some. I also know of some trans doulas who are out there serving in the community. So there are all kinds. And
so how did you move from being an organizer at Harrison to becoming a midwife? Tell me
That
that
is,
story.
that's a good question. So, as I was being an organizer, when I first became an organizer, I actually thought I wanted to be a documentary filmmaker. This is, so I was doing my first organizing job was in Elliott Park, and I'm going to date myself here. I was doing a documentary on what it was like for a woman to go through pregnancy and birth during welfare reform under Clinton.
Okay.
So, way back when, and I was really terrible at it. I was a terrible documentary filmmaker. I still am not allowed to take video on my phone of my children. They tell me I'm terrible at it. I'm not good at it. So eventually I put the camera down and I didn't know at the time, the person's doula. And she was a recovering addict and was going through her pregnancy and birth and had her baby with midwives in the hospital. And I was there and I said, I want to do this. And the midwives were like, you should do this. And I didn't know what this was. But at the same time, I'm also a community organizer. So I'm seeing this amazing intersection of the systems that we live in, the communities that we live in, and the impact on our day-to-day lives and what's important to us and what isn't. And those two just kind of melded together. And so I continued as an organizer for about 10 years before I changed careers. I went to midwifery school.
And what is midwifery school? And what's that experience? Is it a BA? Is it a MA? Is it a PhD or MD?
Not an MD, although I think that there are a handful of MDs who are also midwives. All of the above. So there's different levels of education. And so I went to school, 4 years of school, and then clinical training, and passed a national board exam to become a midwife. And then I'm licensed by the Board of Medical Practice here in Minnesota. So there's a lot of different pathways. We could do a whole show just on pathways.
Sure. Dr. Stanhope, back to the original question. If patients, customers come to North Memorial and they're curious about their options, is there a scenario in which they might be directed or suggested that among their considerations might be reaching out to your partners over in North Minneapolis at the Roots Community Birth Center?
Oh, of course. We're fortunate to have them in the community, as we are fortunate to have other excellent providers of obstetrical care. Me personally, I work exclusively in the hospital. And so I'm not, for example, seeing patients in the clinic for their prenatal care visits. So the individuals that I see in the hospital tend to be those who already have a provider. Those who do not currently have one, we talk about Roots among the other options that they have available in the community. And we continue to look for ways to promote our partnership, because we think that our colleagues at Roots do an excellent job. And so we have continued to look for ways to integrate both our hospital practice, but also make for easier referral lines between Roots and some of our OB colleagues in their outpatient practices.
And so the partnership is really unique, right? In a lot of ways. They talk about this working relationship between both institutions.
Sure. And I think this is something that's really grown organically over the last 4 or 5 years or so, just by proximity to the location of the birth center. They would at times bring individuals who were determined to be of increased risk, that it was a hospital birth was determined, or if an individual desired an epidural. And so we got to know each other through multiple shared patients together. And I think what really grew out of that was, one is that we have a shared desire to continually improve and ensure that the quality of care that we offer to each individual is the best that we can possibly offer. And the other is a commitment to serving the community. And Rebecca and the Roots team have such a unique and special way to provide a service to the community, located right in the heart of it, that it was just such a natural partnership for us to continue to grow and blend our practices.
So Rebecca, tell me what it means to you. You hear the term a lot, the term culturally competent. I think it's a useful term. I think it's a great term. I've used my variation on it is in my profession is to criticize that in many environments, culture is viewed as a liability.
Mhm.
I object to that.
Yes.
I rise to object, and I declare that culture is an asset, not a liability, and that until our institutions and our communities allow us to elevate the importance and the value, the creativity and the resilience, the strength that comes out of culture. Culture represents ways of knowing that sustain us and have sustained us for
Mhm.
generations and millennia, I believe, as human beings. So now, why are we talking about culturally competent care? What's the environment that makes that conversation necessary? And I'm allowing you to criticize the profession in a way that brings them into, and I want at the same time applaud the profession because more than ever, the profession is saying, you know what, uh, there's no single one way, that there are many paths to health and wellness. That's what I'm hearing and seeing as an observer, communicator. Rebecca, what do you think?
I think that you hit the nail on the head. So, and this is where I think my community organizing background heavily influences my practice style. Is that I was very much steeped in that concept of asset mapping around community organizing and not organizing from a deficit perspective. And I brought that to my midwifery practice. What do people have when they walk through the door? Not what are they missing? And one of the things that we have when we walk into any space, when we wake up in the morning, when we lay down to bed, is we have our culture.
Mm-hmm.
That is what we have. That is what builds us, sustains us, connects us to each other. And without that, we are unhealthy. The absence of cultural connection is a state of disease. When so often though, when we encounter health, and it's not just in reproductive care, it's in all aspects of health, but when we are not seen, when our culture is seen as what's wrong with us,
Mm-hmm.
something to overcome, then we can't actually engage in a true health conversation with our providers. And so for us at Roots, one, that means having Black providers. We've got Black folks taking care of Black folks,
Mm-hmm.
and the white folks that are taking care of Black folks are on fire for racial equity.
Mm-hmm.
You don't get through the door without it to work at Roots. But that also means that when we partner with organizations like North, that we're able to have these conversations really openly and not in a board meeting,
Mm-hmm.
but when we do have the times when we need to bring someone in, because we can't do what we do outside of the hospital without a hospital. We can't. It's not safe. We need to be able to access a higher level of care when it's indicated or when someone desires, for example, pain relief so that they don't have a traumatizing birth.
Right.
We're able to come into that institutional space and we are treated with such respect and such camaraderie that we're able to say, what does this person need? Who does this person need around them to have a positive experience and to navigate what may be, usually not what they planned if they planned on having a baby with us. And so having culturally competent care, both in our little bubble, but also when we extend into other people's bubbles and having that be valued and respected is huge. And it does not happen everywhere. And so that's one of the things that we're seeing in our partnership with North is that we're able to have these dialogues on both the individual level and on the macro level.
Dr. Stanhope, you referred to my comment about the miracle of birth, and I'm curious to ask you what that really means to you and how it brought you into your profession and what you experience every time you work with a patient, a woman, a family in the birthing process. Does that idea, that sense of it being an ever unfolding miracle, ever wane, or is it simply affirmed with every engagement that you do as a physician? I call physicians healers as well, but so as a physician and healer, what's your personal feeling and how did that as you described it, draw you into this work?
Sure. Thank you for the question. Thank you for not asking it at the top of the hour, because I probably would have spent the entire 60 minutes talking about that alone. Oh, gosh. So many things to talk about. So I think, first of all, when we interact with healthcare, it's usually in a state of disease. And obstetrics and birthing is so unique in that most of the time it's a state of wellness. Of course, disease can happen, and we need to manage it. But it is such a wonderful time to interact with individuals. There is interaction with patients who are pregnant is a wonderful time to interact with patients too, because this is a time where they're thinking of their baby.
Mm-hmm.
You know, the selflessness of motherhood is continually apparent during pregnancy and the birthing experience, and it is such a special thing to witness that and to be trusted at that important time in their healthcare. And I would say too, I'm a father of 2 young boys. I've got a almost 9-month-old who still has me doing sleepless nights, and having experienced, I've prior to being a parent, I love doing what I do, because it's such a special time to be invited into that moment in individuals' family lives. But after having my boys, one of them was born at North, and we had a wonderful experience. Each subsequent birth takes me back to that time. You know, when I'm in room 364, I like to say this is a special room to me, because this is where my little guy was born.
Mm-hmm.
And so I think it's a special time in anyone's life. And to piggyback a little bit off what Rebecca was saying is culture and wellness coincide so in such important ways. And I think perhaps the 2 most important are the where that intersects most in the most obvious ways is at birth and death. And it is such a privilege to provide obstetrical care to a diverse community that brings in a wealth of birthing experiences and backgrounds. And you can't separate the two. And it's such a wonderful place to get to observe and be part of these important family and cultural traditions. And again, to be a trusted individual as part of that care team.
Rebecca, let people know where to reach you, how they call to get information. And where's your building? Where are you located?
We are at 1901 44th Avenue North, so 44th and Logan. We just finished road construction. We're just down the street from Get Down Coffee. So yay to have coffee in walking distance. It's amazing. So they can call at 612-338-2784. 612-338-2784. Obviously, hit us up on our website, on Instagram. We check messages there all the time, so people can reach out and they'll be connected to our front desk, our amazing front desk team that connects with folks. Yeah.
So let me ask you both how you are navigating your practices during COVID-19. That's affecting everybody around the planet. How does it impact your customers, your community, your workers, your staff? Rebecca, you first, and then Dr. Stanhope.
Well, we every month we look at the data, we look at the science, and we make a plan for the month. This week has me covering call for some staff with COVID, sadly. But the impact on families has been huge. The isolation that people experience during the pandemic has been huge. We're encouraging everyone to get vaccinated. We see it as we know it's safe in pregnancy. We know that the risk of COVID in pregnancy is profound. The impacts on pregnant people are more significant than they are in the general population. So we are actually encouraging folks to get vaccinated.
Quick question just popped in my head. A mom about to deliver, and is contracted COVID-19. What's the impact on the fetus or the child being born? Is there an impact, or is the child protected?
No, the child is not protected necessarily.
Okay.
And it depends on when in pregnancy they're sick and how sick they are. If they have an active infection with symptoms, they cannot birth at Roots. That is a high risk scenario, and they will be transferred to the hospital, sadly. That's where they can give them the support they need if those symptoms become worse for either the birthing person or the infant gets sick. We're also seeing a lot of other things. Sadly, we don't have a ton of research and data. So a lot of our data is just anecdotal data that all of us practices are trying to put together, but we are seeing more hypertension, preeclampsia, hemorrhages, gestational diabetes, lots. Any viral illness in pregnancy carries risk. So.
Any further comments, Dr. Stanhope?
No, I think she summarized that well. COVID isn't transmitted from mom to baby in utero. There are if a baby is going to come down with COVID, it's going to be from transmission after birth. So if a mom does have COVID, we spend time reinforcing the importance of masking, hand hygiene, distancing, etc.
So here's another question I wanted to have you guys both go into. And I'm going to be joined in a few minutes by a second guest for today. The guest leads a effort to empower Black women and to create and support entrepreneurship in our community. And I'm looking at you, Rebecca Holston, as an entrepreneur, organizer, entrepreneur, a business person. And I want to encourage our community, the Black community, people of color, to look at our health, look at the business side of our health, the cost of poor health or of not being healthy, the benefit of being healthy, and the investment it takes both in discipline, opportunity, in just regular medical visits and dental visits, all those things, those are cost. But how do we become aware so that we're not conditioned to think that if our general background has been, working class or sub-working class, maybe impoverished for whatever reasons, that we have this conditioning that says that health will come from going to the county or going to the emergency room, and then they'll take care of it. How do we condition our community to see our active role in maintaining, in a positive way, healthfulness, both of the body and of the mind and of the spirit? And so my story is that I come from a Pentecostal background. My granddad was a preacher in Kansas City, and my grandma, his wife. So my grandfather was like, head to the sky, always looking to the Lord. And my grandmother was like it, but practical. Got to pay the bills, got to do this. So she would always say to me, Alvin, we have to mind our business. And in our case, she said the family business was the church. It's not just the work of salvation and redemption and ministry, but it's also a business, and you got to pay attention to the business. So I take that and look at health. We know about the massive disparities in experiences by Black people here in North Minneapolis and all over the country, and between Blacks and whites in access and outcomes and knowledge, awareness, et cetera. And so how do we convert or change or use that problem as an opportunity to say, now we have a project, and the project is to redefine who we are, not as simply the victims, not as simply the product or the byproduct of these problems, but as proactive solution providers. How do we become part of the solution side of this equation? And in doing so, understand health is a big business, and it's a good business. And what if there were 25 more Rebecca Holstons in North Minneapolis, so that every 8 or 9 or 10 blocks had a center like yours, supporting women and families and children, and all connected to North Memorial with its fabulous resources. How do we monetize the challenges and the needs in a way that we benefit from us being able to solve our problems? So that's a big question. I'm throwing it out there, and I'm going to use that to transition to my next guest. Bring her on camera, my Kenya McKnight, who's an
I knew it was
entrepreneur.
going to be Kenya. I knew you were talking about Kenya. Why wouldn't it be Kenya? Where is she? How do we do? I mean, I think you're doing it on the show, aren't you?
That's what it's all about. That's exactly what it's about. Let's plant the seed, plant the idea. Bring Kenya on the camera to AZ if she's there. There she is. Hey, Kenya.
Hello.
How could he be talking? I'm sorry, I'm totally hijacking on you here, but how could you be talking about anybody else but Kenya with her new building? So exciting.
Thank you, Rebecca.
So impressed. I've been watching.
Thank you. And, thank you for also your trailblazing, efforts and doing this, years ago, and buying your building, the birth center. And so much kudos to you too.
So can you just hang loose for a second? Because I wanted Rebecca and Dr. Stanhope to sort of reflect on this idea of how do we create with intention incomes, wealth in our community by serving our community's health and well-being. Sounds like a good business to me. So Rebecca, what do you think?
Well, here's the sad truth. Obstetrics and birth does not pay in our society. It is not valued. If we look at reimbursement rates for the perinatal episode, and the perinatal episode includes pregnancy through really depends on who you're talking to, but that first year postpartum. That is incredibly undervalued in our reimbursement system. Roots is in network with all insurance payers, commercial and Medicaid. We take state insurance, we take all of it straight MA, the whole thing. If we look at how that is reimbursed, it is abysmal compared to other countries and compared to other health activities. The business side of the perinatal episode is really terrible. We don't value it. And then we also let the decisions around payment be made by even as a business, made by commercial interests and not by public health interests. We really need our healthcare system to be driven by public health and what's actually good for community health versus what's good for the bottom line. I'm going to call out some major insurers who are posting $11 billion in profits while the rest of us are working in a pandemic. Problem. So that doesn't mean that there shouldn't be more practices, that more people shouldn't do that. What it means is that we have to have some real conversations at our legislature on the vast majority of births in Minnesota. I think 60% are paid for by Medicaid. So we should have some real conversations around how Medicaid is paying for the perinatal episode in Minnesota. We have control there. We have influence there. So for example, the global OB package only pays for one postpartum. Everyone knows that's not enough. In the Netherlands, you get every single day in your home postpartum care for 2 weeks.
Okay.
We do so little in our country. And so like at Roots, we do an additional 5 postpartum visits knowing that we don't get paid because it's the bare minimum that we can do. So I think when we're talking about how we influence different health outcomes in our community, we one have to just spread the word, start talking, have people choose to get healthcare with other providers, with Black providers, and at the same time, make sure that we're asking our institutional partners to also show up like in the same way that the Department of Obstetrics is showing up for Roots, because they're doing a great job at it. And because we can't do everything at Roots. I don't want to be that big. That's our niche, is not being that big. I think that we need to look at how we support we don't have enough midwives. Roots is hiring right now.
Yeah.
We need another midwife. There are not enough African-American mental health providers for the demand. Everyone's got a long waiting list. How how do we get our programs to graduate more folks? I think that we're maybe up to 15 Black midwives in the state.
Mm-hmm.
I think we represent 2% of the whole midwifery workforce in the country. So I think that there's some real conversations there around having people vote with their feet and to influence public policy about how we do this differently.
This is a wonderful, wonderful conversation. I want to thank you, Rebecca Polston, midwife and the owner and director of and midwife at Roots Community Birth Center. Thank you so much for being here, for doing what you do, and for this conversation. Thank you, Dr. Todd Stanhope, medical director of the OB/GYN hospitalist team at North Memorial Health. Great conversation. Let's do it again. I think this is just the beginning. And I want to get back with you, Dr. Todd, and others in the hospital industry to figure out, to explore what the economics are and how our communities can find our way to developing and reflecting and experiencing what we have to say are our interest as consumers in the financial equation. I'll close with this thought. You know, I go to Mayo for prostate cancer treatment and service, and I'm just amazed. I'm grateful, number one, but I'm amazed at this complex of science and health and caring and sharing and organization and order. And I say that, like everybody else, I'd love to be able to be a beneficiary of a cancer pill. At some point down the road, you get cancer, you take the pill, you're good to go. But from here to there is a gazillion-dollar enterprise. Bricks and mortar, degrees, schools, training, buses, janitors, landscapers, people creating widgets, engineering. And so how do we figure out that if we are ground zero for all of the ailments, can we convert that to ground zero for the solution and benefit from it? I'm going to stop there with you guys. Thank you, Dr. Stanhope.
And
thank you.
Am I able to add to the?
Well, I'm going to go to you. You're going to be able to flow on this in a minute.
Well, I don't hear it, but okay. It's okay.
But you know, listen, you guys stay as long as you want. Can you go ahead? Because that's why you're here.
I just think that we have to normalize African American culture within these systems, and it currently is not. The building I purchased is actually called the Zara, and it will be dedicated to health and wellness of African American people. So we have a range of different wellness modalities that we use culturally that are not normalized. And so part of it is we have to build infrastructure in our community to serve ourselves. And that's what we're doing. So that means that in the systems, we have to see more Black people who work there in the professional settings as, yes, midwives, but also nurses, doctors, and we have to have a cultural specific approach. We get this right with immigrant communities because we accommodate language and other things. Well, we need that same level of accommodation, right? We speak English, but it's a different English, right? We need to see images of ourselves. I mean, if no one, this country knows a lot about Black people enough to normalize, who we are in these healthcare systems. And at this point, at 2021 and 2022, that we haven't gotten it right is a statement, I think, of value more than what people have information, what you have access to, And so we just have to take it among ourselves to save our own lives and build more infrastructure in our community that then these institutions can partner with us around how to care for ourselves. Now, while they may lose money, our value is our lives. And so how will you partner with our institutions to develop the infrastructure we need to save our own lives?
And we don't know that they're going to lose money. We may discover that our vision, our expectation for what it means to be a human being and healthy creates more wealth for everybody at every point of the equation.
We think
we just haven't tried it. We're just not playing zero sum anymore. We're paying and build out, build on, build up, and create, moving our people towards what I call full self-realization.
In Minnesota, because we show up in other places, but here it's different.
Well, Kenya, thank you for being here. I want to talk about what you and I are working on right now, and that is the Bee Marketplace. I want to introduce that you are the creator of the Black Women's Wealth Alliance, but you've been active in the community as a organizer, a trainer, a entrepreneur, a motivator, and a community builder for a long, long time. I'll say that you and I are cousins. I was looking at our family genealogy page, and I saw Kenya, and I said, Kenya, what you doing on my family's page? He said, what you doing on my family's page? So it's a wonderful connection, a great discovery. We come from a great family. So Kenya, always good to see you.
Thank you.
And applause. You keep doing great things. Talk about the Black Women's Wealth Alliance as a proposition, but also elevate the people you're working with right now with the Bee Marketplace, which launches tomorrow.
Absolutely. We're excited. So the Black Women's Wealth Alliance, we are a public benefit corporation, a social enterprise established in 2014, working to increase Black wealth, Black generational wealth amongst Black women. And we do it through four means of wealth education, technical business support, professional development, and direct financial assistance. And to date, we've served over 4,000 Black women. We've invested over 1.8 million in small capacity grants to help them start businesses, grow their careers, finish school, close on homes, and clean up their credit, and a range of different things. We are now a team of 11, which I'm happy to state. We are Northside. We were born on Northside at McDonald's on West Broadway. And now we have 3 locations across the city. And what we discovered last year in 2020 during COVID, as we operated a business emergency hub for Black businesses impacted across the state. We served over 400 businesses in that. But what we also saw was a large percentage of Black women who were laid off or furloughed or fired from their jobs were starting new businesses and just didn't know where to start, how. And so we thought, we need to do something about it. How can we use our platform, our supporters, our base to help support these women? And so we piloted what we call the Bee Marketplace, which the Queen Bee is part of our culture in BWWA. We have the Queen Bee theory. So we're all about Black women's ego is Queen Bee. So we created the Bee Marketplace as part of that. And what it is an online cultural, marketplace that showcases the talents, gifts, products, services of Black women entrepreneur and business owners. So last year we piloted with 34 Black women, where we provided them with consultation, revamping of their social media sites, their products, and we gave them tools for sales, to track and manage their sales, grow their companies, and some trainings with them. And we invested a minimum of $1,000 into each company, some of up to $5,000. And we just ran a 30-day campaign in partnership with Insight News, where we then promoted them across our networks. And in 30 days, 17 women reported having made $51,000 just from that 30-day campaign. So we're excited. So we're back this year with our second annual Bee Marketplace. We're honored to have Bremer Bank as our sponsoring partner on this, which is great because they're also providing support to the businesses. We're back partnering with Insight News. We brought KMOJ to the table, the city of Minneapolis, and I think Wells Fargo is also a part of this as well. And so we have 35 women with about 50 trying to get in, but we're at capacity. And so we're excited. We're going to provide the same approach. We are this time launching from December 15th through January 30th, 2022. We encourage you to check out our Bee Marketplace website, as well as our social media. We're on Facebook, Instagram, Twitter, and we're excited. So we launch officially tomorrow, but we got some pre-launching going on. So it's the Bee Marketplace, BEE Marketplace.
So exciting, and tomorrow we're going to begin a series of weekly interviews with the women entrepreneurs. So we'll have 4 to 5 to 6 every Wednesday at 1:00 on Conversations with Ellen McFarlane. What happens here? So I get a chance to meet these dynamic leaders, young women entrepreneurs, and get their story. We want to promote them. Our goal is to lift them up and to let people know who they are. But then we also share that content through our website, insightnews.com, through our social media pages, locally and nationally, because this is a virtual marketplace. People can find themselves as customers anywhere from around the world. And then we will use that content to create a series of feature stories in the newspaper. So every week, the following week or so, you'll have these profiles of the entrepreneurs, the B marketplace entrepreneurs who were interviewed the previous week. So the idea is, how do we keep building on the relationship and lifting up? And as Kenya so aptly put it, normalize entrepreneurship, normalize capacity to deliver and capacity to create profit, to build a community. That's what I think we're doing in Kenya. I want to thank you so much.
Absolutely.
Yeah.
And I would say they're getting access to a profile on the Insight News business directory. And we have a website up, and we have the interviews from last year on the website. So go and check out these women. We have videos of their stories, and they're excited. And we have a really special 5-year-old this year who we're featuring in the B Marketplace, Maya, out of forget what city, I'm sorry, but Greater Minnesota. So we're very excited to be highlighting this serious 5-year-old entrepreneur in the B Marketplace. And so she's our shine. And so I just want to give you a prelude. But we do have some great products. And so we encourage you all to come and shop in the B Marketplace. I just want to give acknowledgement to the B Marketplace campaign manager, Brittany Alexander, and the coordinator, Jasmine Patterson, doing a wonderful job at making this all happen. So thank you so much, Al.
So for our listeners here on KFAI, pick up a copy of Insight News. I think this week's paper has a promotion on the B Marketplace, and in the paper is an advertisement that lists all of the members at the marketplace. And we're going to be running that ad or updates of the ad for the next X number of weeks, at least through the end of January, for the duration of this campaign. Again, our goal is to lift these specific businesses up, lift these women up who are entrepreneurs, to help them be successful. So all of my KFAI listeners, I got a job for you. My hope is that you will create conversations in your circle, and the conversations in your circle will be conversations about the power of allyship and the power of consumer choices, right? So that we decide that we're going to use our regular life to support and to grow opportunity in these businesses. Rebecca, what do you think about this? You're an entrepreneur, and what's your thought? What's your feeling?
I think that entrepreneurship is such an amazing path to choose. And it is one that, as a woman, as a Black woman, it's been challenging at times. I'm inspired by the people around me who are also walking this path. I think that it is exactly the sort of shift that we need. We to shift into this place where we're owning and building what we need in our community. It's worth it. Hard, but it's worth it.
Can you take a minute and talk about your new headquarters, I think, on West Broadway? Tell me about that. We got about 2 minutes left.
All right, the Zara. So we are the new owners of.
What's the name mean? What's Zara mean?
Oh, so Zara means to be radiant and to flourish.
Okay.
And in our work, the Black Women's Wealth Alliance, we work with probably about 51% entrepreneurs, and the rest are career professionals. And the range of businesses that we see, primarily those who stick closer to us, are in the health and wellness industry. And this is your doulas, this is your massage therapist, your acupuncturists, and et cetera, energy workers. And so out of that, we understood that this base does not have real infrastructure to operationalize their companies, and they're often hopping around. And we, go outside of our community to places like, the Solar Salon Suites and all these places for these services. And we thought we would create that right on the north side through the Zara, which is located at Fremont and Broadway. Is the 1200 and the 1210 building known as the Home to Breaking Bread or Cafe or Appetite for Change. So that's the building we now own. And we'll be renovating it in 2022 to become an incubator space for Black women entrepreneurs in that space, in the health and wellness industry, known now as the Zara.
I'm so excited. Listen, we're out of time, but thank you, cousin Kenya McKnight Ahad. Thank you for your vision, your work, your tenacity, the wisdom and confidence you bring to your work. Rebecca Polson, thank you so much. I learned so much today. And Dr. Todd Stanhope, thanks to you and all of your colleagues, your team at North Memorial. We're all in this together, and we're going to win together. Thank you all. I'm Al McFarlane. We'll see you next time.